Hello everyone, welcome to Tech Sharmit. In this session, we will discuss about two terms that we are going to use in upcoming topics. Okay, if you remember in previous session also we discussed about these two things and we mentioned these two things, right? Outpatient and inpatient services. And this is the most frequently used term you can say in medical coding. So better to understand the things before we refer these terms in upcoming topics. Okay, so let's start with the basic definition and then we will proceed with the flow. Okay, so what is outpatient service? You can say outpatient setting, service, or outpatient care as well. Okay, so let's focus on definition. So in definition, I have mentioned in an outpatient setting, patient receive medical care without being admitted to hospital or staying overnight. So this is the most important point for this definition. Like whenever a patient is receiving only a medical care, which can include prescription or any suggestion by the doctor, without being admitted to hospital or staying overnight, then this type of service setting or care is known as outpatient setting. Okay. Now, outpatient care is typically provided in clinics, physician office, or ambulatory care center. So just assume there is one patient who is suffering from some minor disease, okay, and they that disease do not require that much of concern because this is just a minor issue. So what he can do, he can simply visit any clinic, physician office, or somewhere in the ambulatory care center as well. So what they will do, they will suggest them some disease, some medicine, okay, and some suggestion also they will provide so that it will cure the minor issues. Okay, so in this case he don't need to be admitted in the hospital because this is just a small and you can say minor disease. So this type of service, when a patient is not uh, when a patient is provided with a medical care without being admitted to hospital or staying overnight in the hospital, then this type of service is known as outpatient service or outpatient setting. Fine. Now, there might be one question, what all services are included in this? So just look at the second point. And outpatient service included uh, routine checkups, okay, regular routine checkups, diagnostic test, uh, then we have minor surgeries, preventive care, and other medical treatment that do not require an extended stay. So whenever there is no need for the extended stay, we will consider those services as outpatient service, which include like regular checkup, you can say, right, very minor surgeries, preventive care. So these all are considered inside outpatient setting. Now, third point is for duration of stay. I would say this is the most important factor which will help you to differentiate between the inpatient and outpatient setting, because duration of stay is only parameter through which you can easily identify like which type of service you are providing or you are taking. Okay, so in duration of stay it is mentioned patient in the outpatient setting usually receives care for a few hours or less. As I told you, these are the minor issues. So in this case, medical treatment is provided for few hours or less than few hours or very, okay, and they leave the facility on the same day, because that if the issue is not that much big, then what like he will be allowed to leave the facility on the same day because some suggestions or some prescription would be provided and then he can simply leave the facility, because those were not, because these type of disease comes under out, like whatever the disease comes under outpatient setting, they do not require that much of medication or observation. Now I will tell you few example for outpatient care include, okay, that will help you to understand what type of diseases are there. So first one is common cold or flu. You can identify, yes, because common cold is something that that do not require that much of attention, right? Because this is just a minor problem, so you can simply visit to any clinic, physician, or ambulatory care center for the treatment. Then we have minor injuries like sprains, minor cuts. So this is also included in outpatient setting. Then we have routine checkup, vaccination, chronic condition like hypertension, diabetes. So these all are considered inside outpatient setting or service. I hope this is clear. Now we will move to the next point. And the next point, which is next service, inpatient setting or service, this is completely opposite to the first point which we learned, which is outpatient setting. So this is just opposite of it. Let's look at the definition. Here it is mentioned, in inpatient setting, patients are admitted to hospital or other healthcare facility for extended period. Why? Because in this case, diseases are major. There are major issues. So to resolve the major issues, what is the need? Need is to admit the patient in hospital or other healthcare facility for an extended period. Further, it is saying inpatient care is provided when patient require more comprehensive and specialized medical attention. As I told you, in case of major issues, special or comprehensive medical treatment is provided that cannot be delivered on an outpatient basis. Because if the issues are major, how can we consider it as an outpatient, right? Let's say if someone is suffering from heart attack, so you can't say to him that take these medicine and come again, right? Because that need higher level of attention, because that disease is higher level. Okay. Then what are the services that come under this inpatient setting? Inpatient service encompass a wide range of medical care, including surgeries, complex medical treatment, management of severe illness, and ongoing monitoring and care. Why? Because as I told you that it is a major issues. So in this case, we need proper monitoring. Like patient should be admitted, he should be monitored, he should be provided some medication, then doctor should uh, observe the changes, the response of medication, and accordingly the doctors can provide the further treatment. So in this case, monitoring is very important factor. That's why the doctors are asking patient to admit. Okay. Then the most important factor, duration of stay. Here it is mentioned, patient in the inpatient setting stay in the hospital for an extended period, which can range from day to several weeks, depending on the situation, depending on the nature of severity of their condition. So in this case, if needed, patient are asked to stay for several weeks. Okay, sometime in case, sometime in for the month as well in some cases. Okay, fine. Now we have few examples which will help you to understand this inpatient setting. The first disease is heart attack. As I told you that this is the major issue. So in this case, patient is asked for the like patient is admitted in the hospital. Then we have pneumonia. Then we have open heart surgery, severe trauma or injuries, chemotherapy or for cancer. So these are all are the major issues, right? These are not the minor one. These are the major issues, so they need more attention. So in this case, patients are supposed to be hospitalized in the hospital in order to take the proper medication. Depending on the situation, the duration of stay is extended. Let's say if someone is facing critical condition for heart surgery, so he will, and he is taking much longer time to cure the disease or uh, to provide, like if the patient is needed to be stay for the longer time, then he will be provided with some extra medication and monitoring. Okay, so yeah, these are the some points which is related to inpatient and outpatient services. I hope it is clear to all of you. And these all type of conditions are highly referred in the upcoming point. That's why I just take these two definitions separately, because in the upcoming session or maybe we will refer these terms. So better to learn about this. Okay. So yeah, that's all for this session. I hope it is clear to all of you. In the next session, we will discuss few more things. So thank you for watching Tech Sharmit.